Welcome to video 20 for chapter 7-8 on the skeleton and anatomy and physiology. And we're going to start our discussion on the pelvic girdle with this video. The pelvic girdle is a complete bony ring that connects the lower leg to the sacrum of the axial skeleton. And this complete bony ring offers more stability than motility, or mobility, we'll say, instead of motility. So this is something that allows us to have an upright position and to walk. So our pelvis has evolved from lower animals in order to allow an upright position. And so our pelvis is not as elongated as one of your pets might be. In females, here is where we also have a passageway for birth. And it also provides support and protection for the fetus as it develops. So here we end up with a major difference between males and females with the pelvic girdle. So we'll be looking at that a little bit more in depth later. So the pelvis is actually, like I said, forms a bony ring with the sacrum. So the pelvis is actually all of that combined. So we end up with the sacrum plus two coxal bones form the ring that we talked about. Now, the coxal bones, we have a right and left bone. They join anteriorly and articulate posteriorly with the sacrum. So this coxal bone forms from the fusion of three parts. And we'll look at those three parts when we look at the diagram, but they are called the ilium, the ischium, and the pubis. So the ilium is the superior part of the coxal bone. The ischium is inferior, posterior, and the pubis is inferior, anterior. So we have four major landmarks that we're going to look at on this. But before we do that, let's go ahead and look at these bones on our diagram on the next page. So here is a diagrammatic view of the three parts. Here is a lateral view and a medial view of the right coxal bone. So the ilium is this part, and this structure right here where the three meet up is called the acetabulum, and we'll talk about that here in a little bit. But you can see that the other two parts are inferior. One is anterior, one is posterior. So we end up with these bones fusing together to form one bone. And we have this opening right here, or this big fossa called the acetabulum. Here is an anterior and a posterior view where you can see A is labeled the ilium, B is kind of behind it, and that is the ischium, and C is right here, the pubis. They join together right here called the symphysis pubis. So that is a disc of cartilage. And then they articulate here with something called the sacroiliac joint, which is the articulation between the sacrum, and here's the coccyx, and then here are the lumbar vertebrae. And you can see this joint back here too, and there's a very, very thick ligaments that support this. So these landmarks, the pubis symphysis or symphysis pubis, I've heard it both, is a disc of cartilage. And this is a fixed joint, which means that it does not move. So the two pubis parts of the coxal bone actually join here with an interpubic disc to form this joint, and it does not move. Now, on occasion, if you have a broken pelvis, we can end up with something called a book fracture, where that does separate and opens like a book. You can't, this is pretty much down towards your genital region, and you might be able to feel the pubic bone or the pubis a little bit if you press down there a little bit. So the acetabulum is a large fossa on the lateral side of the coxal bone. This is the articulation site for the femoral head, so the head of the femur. So this is the ball, the socket for the ball. This is the site of fusion of the three parts of the bone. So this is where the ilium, the ischium, and the pubis actually meet and fuse, and it does not completely fuse until about 16 to 18 years old. So right now, your acetabulum is actually just finishing up fusing and solidifying properly. The iliac crest is a spine on the ilium. It is a landmark for injections on the buttocks. So this is something that you can actually feel. It's up towards the top of your hip, kind of like where your waist is. If you're really skinny, you might even see this on somebody. And this corresponds to a dimple that can be found superior on the buttocks. And that will be with people that are not overweight, that you might see this as a dimple or an indentation. So that is the iliac crest. The obturator foramen is the large opening, and it is actually filled with connective tissue and is a passageway for vessels and nerves. So we'll mark these on the next video on the diagram.